For the latest COVID-19 news and updates, visit Hartford Healthcare's coronavirus website.
To the letter, and it's appreciated. The governor's informed me that for these sessions, when we have some social distancing, it's appropriate for the speaker to take off the mask. So I'm going to do that and then slip it right back on. We appreciate very much having Governor Lamont here today and to seeing the assembled media. I know that you have a big picture in a great many respects to cover today. The thing that we would express is that we are excited to look forward as part of the reopen Connecticut Phase 2 plan to bring the Connecticut Science Center back online soon, and that is part of a much bigger picture that the governor and his team are leading. So it's my honor now to stand aside and invite Governor Lamont to the podium, and then I'll fill in some blanks about the Connecticut Science Center's particular plans as is appropriate. Governor, thank you.
Well, thanks, Matt, and I'm glad to see the Science Center is going to be getting open next week. A lot's getting open next week. That's going to represent about 95% of our economy will be open on May 17th. A couple days later for the Science Center, but not much. And I love being here at the Science Center, what it represents, an amazing public-private partnership. I'll just give you quickly the numbers. Our infection rate was lowest we've seen in a long time, down around 2% or less. That's incredibly important. Hospitalizations are 2/3 below where they were when we opened up on Phase 1, May 20th. 2/3 below where they were. So I don't think we opened too early, and I think we've opened cautiously, and I think we've kept things moving in the right direction. And that's why June 17th will be such an important change for us going forward. Obviously, restaurants, hotels, and the such. I just wanted to reflect for a minute, if I could. It was about 100 days ago, almost 100 days ago, that we got hit by COVID. And now next week, we're going to be reopening a final piece of our economy up to 95%, like I said. And we've learned a lot. And I just wanted to reflect on that as we think about what could happen in the future, what could happen as a second wave, and just more broadly. I mean, one of the first things when I became governor is I saw a state government that didn't always work together. Everybody was talking about silos and every department, every commission doing their own thing. We said, let's get a chief operating officer. Let's make sure these departments can work together, a little like I was used to in the private sector. Well, COVID sure woke us up to that, because all of a sudden we were having a unified command meeting virtually every day for 60 days. And we had every commissioner, and we had police, and we had the not-for-profits, and we had the hospitals virtually around the table. And we realized, oh my God, public health has a lot to say to corrections, and everybody wanted to hear from DAS, Department of Administrative Services, because they were tracking the flight from China, bringing the next supply of gowns and masks that were in such short supply back then. So we learned a lot about how we work together better as a state. We also realized it was a healthcare crisis, and you need the hospitals at the table. When I talk about a bigger table, it's not just the state government, but it's a broader group than that. And frankly, the state hadn't had a great relationship with the hospitals going back some time. We patched that up. Hospitals were at the table early on, and they worked together as one. It was so important. I mean, when our southern hospitals, southern part of the state, were getting overwhelmed, our hospitals here in Hartford were there to be able to help out with masks, help out with vents, help out with the nurses. And then it was Southern Connecticut's turn to help out as well. And that's what you realize you could do when that table is bigger, and it included the hospitals. Another thing I tried to do when I came on was I said, look, Connecticut's not an island, and we do better when we work with our neighbors. In this case, I was talking about our neighboring states. And when I had that fishing trip with Andrew Cuomo, we were talking about what could impact all of our states. Back then, we were thinking about, economic development and transportation. We were also, at that point, thinking about the idea of a cyber attack. And obviously, a cyber attack knows no border. Well, we learned pretty quickly that COVID is another attack that knows no border. And we found we were working together very closely, all the regional governors. What we had to do in terms of closing down our schools more or less at the same time, although most of the schools had closed down already. You know, Andrew and I and Charlie Baker and I up in Massachusetts wanted to close down bars and restaurants at the same time. We saw them as places where infection can spread and spread quickly. And we did that. And now slowly we are reopening. Obviously we're reopening a lot faster than they are in New York. They're in a different place in the pandemic. But it's very helpful for us to be speaking with one voice. As people say, what's next? What's next in the pandemic? What's next in terms of how we secure ourselves? What's next in terms of schools and phased reopening? And the message coming from the White House is not always as clear as day, you might say. And I thought it was really important that we governors were able to speak with one voice as well. Another thing I realized early on was hospitals were a big piece of our solution in a healthcare crisis. We also needed the scientific community. We needed epidemiologists. We needed those that specialize in infectious diseases. We had a lot of amazing people in our state government. I think you've learned that. I've certainly been reminded of that. I hope the people of Connecticut, during our briefings on most afternoons, you got to see the people in public health and public safety and social services working, 7 days a week in many cases, doing everything they can to make sure we kept this pandemic under control. But we don't know everything, and we're much better off when the table is bigger. We have that outside expertise at the table. And that's why we created the reopening committee, the scientific team led by Dr. Ko. We also had a business group, mainly small business, restaurants and retail and hotels. And we really wanted to make sure that as we explained what the scientific rationale was for closing things up, also how we could get things open, why we get things open, and how we could do it safely. It was really important that the Restaurant Association be there, so they were on board, understood what we were trying to do, and also labor was at the table, so that employees would feel safe going back to work. I love the idea of a bigger table. I said that when I came on board. I was thinking about legislators, I was thinking about state government officials, and I was also thinking about folks not in government. And there, we learned a few things. After a while, the Reopen Committee started getting some pushback. You maybe heard it. They said, who are these, corporate talking heads? Who are these academic elitists? Who are these people coming in and telling us what to do? I said, thank you. And I say it again. We need you. We'll need you next time that things come on, and I hope that relationship is going. I know the hesitancy about not having everything decided within here, this Hartford ecosystem, but I think we're better when we keep open on this. And we worked hard to keep our legislators briefed. I think Len Fasano and Dr. Ko have a very close relationship, as we worked hard with the legislature to make sure they knew what we were doing, why we were trying to do it, and if they had a better idea, where they would take it. Then, just last week, you probably saw that the Connecticut Partnership also went the other way. Again, that was a group of outsiders. That was a little more complicated because there was private money and public money side by side. I thought it was an amazing template. I thought we could take $100 million of public resources, turn that into $300 million, and use that with not-for-profits and educators, the legislative leaders, all at the table, making sure we could do more for our kids. And I thought this was the important time to do it. Our kids have been out of the classroom for the last 3 or 4 months. What we could do with that money to help them get ready for school and make sure school is ready for them. Anyway, we got to think about how we get those folks, involved. Within a week or two of us announcing the partnership, somebody went to the floor of the State House of Representatives and said, who are all these corporate board guys dropping dollars on we peasants? And I got to tell you, that was an attitude that killed any opportunity for us to do much fundraising. And I got to figure out how we can do better to put together a structure that is transparent, that gives you confidence they're acting in the public interest, and we can leverage their amazing resources, their intellectual resources and their financial resources. And I'll just leave you, when I took over, I saw the Port Authority, another quasi. And Len had said, hey, watch out for these quasis. We need clear rules of the road in terms of reporting and such, how they do it. And then before that, we had the lottery. So I'm going to ask Len, and I'm going to ask Joe Arasimowicz, a Republican and Democrat, House and Senate, Business and Labor, to work with me to see if we can figure out what are the rules of the road, where we don't stiff-arm people that want to be helpful in any way, but we welcome them to the table in a way that we can tap their expertise, tap their incredible sense of citizenship to participate and make a difference, just like we used the reopening committee to make an enormous difference here on close to day 100 of the COVID crisis. I think we did a lot better by utilizing the incredible wealth, talent, expertise of the entire state of Connecticut, and I don't want to think that our resources end right here in this city. That's what I wanted to tell you as we think about June 17th and our next stage going forward. Thanks, everybody.
Contact tracing and recent protests. Can you walk us through what this stage looks like as far as contact tracing some of those protests and what that really looks like?
Yeah, the question is, if you can hear with all the traffic, contact tracing, and don't these protests, make that a little more complicated? Because you probably were not in contact with 4 or 10 people, but you were in contact maybe with hundreds of people, depending on that. And it's incredibly complicated. And I see that Andrew Cuomo said, look, go get tested. I see that Dr. Birx said, whatever you do, if you've been to one of these protests, don't go visit your parents or grandparents for a while. Wait and see if there are any symptoms. Time will tell whether this leads to a flare-up or not. It's going to be pretty darn complicated to track and trace each and every one of those possibilities.
Governor, did Pisano and Arasimowicz agree to do this? You already asked them. And what's your agenda? I mean, you asking them to look back on what happened, or are you asking them to look forward?
No, I want to look forward. I don't spend a lot of time looking back, Paz. I've talked to Len about this quite a bit. I've talked to Joe about it somewhat as well. I said, how do we put together structures that the outside folks know that they can come in and participate in a way? They need to know what are the rules of the road. As we put together these commissions, what are the expertises you want at the table, first of all? Is everybody subject to FOIA? Do you read all their emails or not? Do you do it if you're on the board here at the Science Center because they take public money? Or do we have different carve-outs? How about financial reporting? Does everybody have to do that? Give us clear rules that I can tell the greater population, we want you involved, we're a better state for your involvement, and here's how we do it.
Do you have an activity in mind for another public-private partnership that this would clear the road for?
We'll see. I mean, I was just talking the other day with our police accountability and the transparency board. Again, a wider group of people from outside. Many of them are public officials already, as you know. But I think the table is much more informed if it's more inclusive and you have a wider variety of people there. And I don't want to stiff arm them. I want to welcome them to the table and find a way we can do it that also involves the legislature so we feel confident we're doing it in the interest of the public.
We'll see is not responsive to the question of, do you have something in mind right now on what you want to do with a public-private partnership in the future?
Again, I think if there was another pandemic, I need another reopen committee, and I need scientists who will be at the table to inform me. Right now, maybe there's a little hesitancy given some of the challenges. I've got an economic development team, as you know, and I've got 4CT. These are folks who are volunteering their efforts every day. I want them involved. Those are the type of programs I'd like to continue to grow and expand. I want to see other quasis going forward. As you look at what we did on the Port Authority, look what we did as we try and rejuvenate the lottery. I want the best and the brightest knowing they can be on that board, feel confident they're on their board, and they know what the rules are.
What kind of help are you going to need from the legislature? You talked earlier about benefits, working together, regionalization, we can learn, but there have been casualties. People have lost their lives and businesses have been decimated by this, by being closed. What kind of rules or work do you want to do with the legislature? What is necessary to keep businesses from going out of business?
Yeah, so two things. I want to see where the legislature feels comfortable with this concept of public-private partnerships, feels comfortable with the quasis as we've described them, the advisory boards like I had. Obviously, there was some negative comment that got a lot of play, and I just want to get to the bottom of that. Do you feel confident with the structure if it's appropriately set up, or you just really want government to be public dollars and public sector employees? You know, more broadly, it's about reopening. Like I said, you know, Cuomo is reopening next week. He's opening things that we never even closed down here in the state of Connecticut: construction and elective surgery and manufacturing. So I'm doing everything I can with the scientific team, by the way, to give consumers and employees confidence it's safe to go back to work. I got about half of that. It's all noisy back there. But the look, in terms of a Department of Labor, we processed 580,000 claims, I think it is, which is probably 2 claims for everybody that's actually unemployed. A lot of people have gone back. A lot were on temporary furlough. But we put, I think, $8.8 billion, mainly federal money, out to work right now. But Sue, as you've heard me say a couple of times, let's not rely upon the unemployment. Certainly let's not rely upon that $600 true-up they've got. That only lasts another 6 weeks. I've got to make sure that people know they've got to get back to work and know that they can do it safely.
Do you want to give us an update on the negotiations with labor and their raises?
The question is about labor and their raises. Yeah, we've had good discussions. But not productive discussions. I said, look, I treasure the people that are on the front lines, especially those folks that are on the front lines over this last, 90 days. Those folks who couldn't telecommute, those folks who were social service workers, those folks in corrections, those folks who are putting themselves at risk, those folks who, put themselves at risk of COVID. And if you were in the nursing homes, they got a raise. Others, I said, I think you deserve some combat pay. You know, that's how in my world, the private sector, you delivered. And you delivered at considerable risk to yourself, and you deserve that. But I also said something else, Sue. I said, I can't see giving everybody in state government a raise right now. It's scheduled for June 30th. I appreciate my predecessors, so I'll leave you with this obligation. I would put it off, and I think you should put it off. I think we're in an economy where you've got close to 20% unemployment. I think you're in an economy where you see a lot of people on furlough. You see a lot of people taking, 20% off their paychecks just so they can keep their jobs. And I think that would send the right signal, and that's how we work together. I'm not looking to lay anybody off, but I think that's what you should do.
Do you have the authority to do that without negotiation? Can you withhold those raises?
No. I've tried. No. I can't find any way that I could do that.
So what's your leverage?
My leverage is right here, right now, talking to people saying, look, I think this is what we put on the table. I thought it made good sense. Combat pay for people that deserve it on the front lines. Others just take a pause, some months, just like I've seen in many other states around the country. No, we don't have a lot of leverage under the contract for another year or so.
Governor, with as much as you value public-private partnerships, nursing homes are sort of set up in the same way as private entities receiving some kind of public support and oversight. Is that really the correct structure for a nursing home with all of the problems that we've seen there?
I'm not sure. That's a really good point. I mean, hospitals, they're sort of public-private themselves, but they stood up. They said, we're going to do everything we can for PPE for our people. It was easier to work. The nursing homes are sort of more independent actors. They're primarily private sector. And yet it was, I need more for frontline nurses, which we gave more for frontline nurses. I worried about the infection protocols there. We did 3 inspections of the nursing homes over the last few months. Now we have an outside group doing as well to make sure that if something happens again in October, November, we're better prepared.
Also wanted to ask you, there's a district judge that just came out with a decision fingerprints for the new gun applications. What's your response to that?
A, I think we were about to do that anyway. B, every executive order I did was in the name of public health. And at one point, I thought the idea of people going in, fingerprinting was not where we wanted to be. I think we'll be able to work this through since hopefully for now anyway, our infection rate is very low and we're reopening most of these things in the next 8 days.
Governor, when it comes to reopening bars, what numbers would you need to see in terms of testing and hospitalizations?
The question is about bars and nightclubs. Look, I worry. I mean, I saw what that super spreader in South Korea did, and that represented hundreds of new infections there. And so, my hesitancy, bars, especially inside bars, nightclubs, not great for social distancing, mask is off. So I am hesitant, but obviously I will look at my neighboring states as well to see, all right, I think reality is set in, it's time to open up.
We don't have a specific level for the metrics that you want to see for that.
I don't have a specific metric per se, no.
Are nail salons included in these?
Yes.
What about state campgrounds? Sorry, go ahead.
State campgrounds?
I was just going to ask about state campgrounds because some of the private campgrounds have been open since like the beginning of May.
I think the state campgrounds, maybe these guys can help me, are July 8th. Not getting much help back here. I think July 8th was the theory because our camps, our parks are going to be pretty overwhelmed this weekend anyway. Camping will be more appropriate after the July 4th weekend.
Governor, back to your public-private partnership idea, is that something you brought to labor that maybe you would do that with the agencies?
That's a little bigger. Do with the agencies, what, Department of Social Services, you mean, or something like that? Well, you certainly see what's the most effective way to deliver social services, that's for sure.
Governor, we get questions. People want to know what's the rationale if hundreds of people can gather at Hammonasset, granted spread out. Why the delay until July on when a socially distant graduation takes place?
I think we thought, well, first of all, our graduations are up to 150 people on July 6th outside. We made that determination, a week or so ago. 2 weeks ago, we didn't know what June was going to look like, so we were a little hesitant to be more aggressive there. Beaches, we never closed the beaches, as you know. We never closed the parks. We were very clear about 15 feet spacing, blankets and the such. And I think you're right, though. What's the difference between a graduation and a wedding? That's another question you could ask. Well, we just thought a graduation is easier for people to social distance, easier for parents to be there in the background and take it, and we'll get more aggressive thereafter, depending on how it comes out. Anything else you'd like to say?
Thanks, Governor. Thank you, Governor. Thanks for the insight on your thinking about the Reopen Connecticut plan. I would just, for the Science Center's part, just say that we have appreciated the collaboration with the Reopen Connecticut team. There have been very important and very specific aspects of the guidelines for indoor museums, of which we are one, that we've had a great discussion over, and our institution is able to implement the agreed upon plans to assure that our visitors are going to be safe, that the experience will be enjoyable, and we look forward very much to welcoming first our members on June 20th. You can be sure that the rigors of a public-facing institution like the Connecticut Science Center, which is inherently about hands-on engagement with multi-generational customers, presents its challenges. And we've taken those on with great seriousness, and it's involved everything from assuring that we have a proper supply of PPE and stock of sanitizer to very specific actions. For example, we have very large spaces in the Science Center with a lot of sunlight, which are good things in terms of air quality and disease management. And we've added to that special filtering of our air conditioning systems, changing the ratio of fresh air versus circulated air. A lot of these things sound kind of particular, like the 50-odd plumbing fixtures to move from you touch it to hands-free flushing. These are not glorious endeavors, but they're important to minimizing the contact points for individuals. And then we'll have a very rigorous cleaning program so that people will have the ability to self-clean exhibits, doorknobs, etc., everything they touch before and or after, but also that our staff will be doing those things. And we'll be moving to, and this is probably one of the biggest changes in habit that all public serving institutions like ours are having to confront, to manage to the reduced capacity at a given point of time that the guidelines require, means that we have to know how many tickets we're selling at a part of the day. So we're moving to an online advanced ticketing model, which is happening in a lot of institutions. But that's a major change in behavior for our operations and also for our visitors. So we're looking for a partnership with our audience to take care of one another, our staff, our visitors, and their fellow visitors. We're going to insist on proper utilization of face masks at all times, and we're going to provide every resource we can to assure that people know what to do and can have a visit that is enjoyable and safe. So this is a small increment. I think most businesses, including ours, will come online at a loss. I mean, this is not like a fast recovery where you open the door and suddenly have enough revenue to pay the expenses that are actually in many cases increased to provide the service we have to. But we're part of Connecticut. We're part of this community. And above all, we're a science learning institution that really is here for the purpose of inspiring people to think, act, and be informed in a science-minded way, not only in our actions today, but in the future through the generations that we serve. So that balance is the one we mean to walk, to make this a safe, healthy, enjoyable, educational experience for all. So we appreciate the opportunity to talk about that today, to work with the team to do the reopening in the right way, Governor. And we look forward to getting back online in the very near future.
June 20th, right?